We're just going to go through a physical exam on Waggle here. So there's a couple of things that you probably want to do before you actually have the dog on the table. First of all, when you take the dog into the waiting room, you should already be watching them, how they're moving, doing an initial assessment on their behavior, reading any kind of warning signs that you might be getting in terms of whether they might be a care dog, that kind of thing. So that's the general appearance and demeanor, first assessed from a distance. And that's essentially for behavior and any mental cues. So the second section on your physical exam sheet is the throat. We're not going to really talk about the throat in this lab, but we will expect you to know a little bit about the examination of the throat by the end of the semester. So when you're palpating the throat on a dog, you cup your fingers underneath the neck. You start just behind the jawbone, and what you're feeling is the larynx, so the throat, and then the airway, which is the trachea. Especially if you have an animal that's coughing, a dog that's coughing, if you press on the trachea very firmly, oftentimes you will elicit a cough. And you can judge what type of cough it is depending on whether you get that reaction or not. In a cat, when you're assessing the throat, you're trying to feel for what's called a goiter, which is an enlarged thyroid. And what you're doing, again, you're taking your fingers underneath, and you usually go from top to bottom on either side of the windpipe, the trachea, and you roll your fingers down to the thoracic inlet, and then you roll them back up again. Or you can do it with two fingers, one on either side of the trachea. And if you can feel an enlarged thyroid, you should feel it as kind of like a lump that kind of slips underneath your finger. Should be fairly soft. So that is essentially the throat. One final thing is, if as you're feeling it, they seem really uncomfortable and gulping, sometimes that can be a sign that they have a foreign body lodged in their throat. The next section on your physical exam sheet is the examination of the mouth. And so when we're examining the mouth, we first start off by lifting up the lips so that you can examine the gums. Now in most dogs, you can see both pink and black gums. Waggle actually has a very good example of this. She has black gum and pink gum. And the first thing we're going to do is we're going to look at the gums, see what color they are. Are they a nice healthy pink? Are they pale? Are they yellow? And then we're going to do what's called a capillary refill time, where you press on the gum and it turns white, and then you see how quickly it turns pink again. So again, you put your finger on, you press firmly, turns white, and then very quickly, usually within 2 seconds, it will return back to pink. And that is called the capillary refill time. The capillaries are the tiny little blood vessels that supply blood to all the cells in the body. And if there is good blood pressure in the capillaries, then you will have a fast capillary refill time. If there is poor blood pressure or poor circulation in the capillary bed, then you will get a slow capillary refill time. It will be sluggish, it will be more than 2 to 3 seconds. And that can be a sign of shock or a low blood pressure. The other thing we check the gums for is how moist they are. Usually they will be nice and moist. If you rub your fingers on them, your fingers won't kind of catch and stick. And that's one way of assessing for hydration problems. Then also in the mouth, we're obviously examining the teeth. Next year we'll talk about the numbers of the different teeth. But for now, we have incisors at the front, the big pointy canines, we have premolars here, and then right at the back we have molars. And you're looking to see that the gum line around the teeth is healthy. Sometimes it can be a slightly redder pink than the rest of the gums, but if it's really bright red, then that can be a sign of inflammation or gingivitis. We're also looking at the color of the teeth to see whether they are nice and white, whether there's any brown calculus, any sign of any infection or inflammation. And we'll obviously make a note in the record if we see any of that. And you need to examine all 4 quadrants. So top right, top left, and bottom right, to make sure that you've checked all the teeth and all the way to the back. The next step in mouth exam is opening the mouth all the way, looking right to the back of the throat, looking at the tongue, and the other thing is to look underneath the tongue. And to look underneath the tongue, you have to put your finger between the mandibles and press up. And usually that will cause the animal to lift up its tongue so that you can see the underside of the tongue. It's particularly important in animals that have a history of vomiting, because sometimes, especially in cats, they can have string underneath their tongue, and so we will look for that. Not sure if Waggles is going to cooperate here, but if I put my finger underneath between the jawbone, and then you can see that her tongue kind of comes up. She doesn't like it, but you can look on either side and hopefully see around the base of the tongue. I know, I'm sorry, it's not very nice, is it? Good. Okay, so next is ears. The ears, you can't see obviously all the way into the ear canal, but what we do is we lift up the ear flap and we maneuver the ear flap so that we can see as far as possible into the ear canal. The ear canal in the dog is an L shape, so it goes down and then in. So from the ear entrance here, it goes down the side of the head and then into the head. If you really pull the ear out, you can straighten it out, and that's what you'll do when you do an otoscopic exam. Is you'll put the otoscope into the ear and then you'll lift the ear away from the head so that you straighten out the ear canal and you see all the way to the eardrum. When you're examining the ear, you're looking for a nice, healthy, pale pink color. It's really important to sniff and get used to the odor of a normal ear. If it has an ear infection, then oftentimes there'll be a yeasty smell or a smell of infection in there. The other thing I do is I palpate around. So I'm putting my thumb and forefinger around the base of the ear and I'm actually palpating the ear canal through the skin. And oftentimes if there's a nasty infection, this will be painful. And so that's an important thing to do. So you do it on one side, you do it on the other side, you compare, you make sure that everything is symmetrical. You're doing very well. Good. Okay, next is eyes, which we're going to cover in the next lab, lab number 5. When we're looking at the eyes, we want to make sure that the eyes are clear. So the front part of the eye, the cornea, should be clear, it shouldn't be cloudy, there should be no blood vessels. We want to be able to see all the way through that front part of the eye to the colored part, which is the iris, which is behind the daisy. Show one Waggle, that's good girl. You want to be able to see that colored part. So the colored part, which is blue or brown in most dogs, is the iris, and then the hole in the middle, the black bit in the middle, is the pupil. So usually we'll take a light, we'll shine a light in the eye, we'll be looking for clarity of the cornea, we'll be looking at the iris, and we'll be looking at the size of the pupils. The pupils should both be the same size, and they should get smaller, they should constrict with the light. We're also going to put a finger on the upper and the lower eyelid. We're going to press through the upper eyelid and we're going to look at the third eyelid, which comes up. If you press through the upper eyelid, let me just try that again. Move your bum away from the edge of the table. Absolutely fall. So we're going to put finger one on top, one on the bottom. We press on the upper eyelid with this finger and you should be able to see the third eyelid popping up. That is part of the conjunctiva, and dogs have third eyelids, we do not. And you can assess for redness or any sign of pink eye or conjunctivitis. We can also do the same when we lift up the upper eyelid or pull down the lower eyelid. We're also looking at the pink parts of the eye. Again, there's some pigment in there. We can assess for color, same as we did with the mucous membranes in the mouth. Make sure it's pink, it's not pale, it's not yellow. Not blue, and also to make sure there's no sign of inflammation, which would be conjunctivitis. The eyelids themselves should be nice and comfortable. You shouldn't see any squinting or winking, which is a sign of pain. And you're also checking to make sure there's no discharge. Okay, so lymph nodes. The most important lymph nodes that you need to know are the submandibular lymph nodes, which are just below the angle of the jaw. Also the prescapular lymph nodes. The scapular is the shoulder blade, and pre basically means in front of. It should really be cranial, but they're called prescapular lymph nodes. And then the other one is in the back of the knee. It's called the popliteal lymph node. So on the dog, again, thumb and forefinger, we're going to feel along the bottom of the jaw till we get to where it goes from horizontal to vertical. You'll feel the angle of the jaw there. We're going to put our fingers just to the inside or medial side of that space, and we're going to feel. There's also a salivary gland in there, so sometimes it's hard to tell whether you're feeling the salivary gland or the lymph node. So that is the submandibular lymph node. For the prescapular lymph nodes, you need to find the point of the shoulder, which is down here, and then you run your fingers up. You can actually feel the scapula, and then up here is the top of the scapula. About halfway down the scapula on the front is where you would feel the prescapular lymph node. Can you stand up? Can you stand up? Good girl. What a good girl. Okay, the popliteal lymph nodes. So this is her knee joint here, the one that points forward. It's called the stifle. In the back of the stifle, in here, right in the back of the joint where there's a change in the angle. So the back of the thigh comes down, and then the leg changes angle. And right where the angle change happens, you feel around in there. And if you feel kind of a small bump, that's probably the lymph node. In a normal dog, most of the time you won't be able to feel the lymph nodes. Same in a cat. So there are other places where you may feel lymph nodes, in the armpit or the axilla, and also in the groin, but it's very unusual to be able to feel those lymph nodes. Good girl. Can you sit? Can you sit? Good girl. What a good girl. Okay, so skin. There's lots to look at in the skin, and again, this is not what we're going to be covering in this lab, but basically you are going to be pulling back the fur against the grain, and then looking at the underlying skin underneath. In most dogs, the skin is pink. Sometimes it's pigmented. There are areas where it's easier to see the skin, like on the belly and in the armpits. And just depending on what the problem is that the dog presents with, you're going to need to describe the skin lesions that you see, whether it's redness, erythema, or nodules, or various other terms. Again, they're not terms that you know right now, but they're terms that we'll be covering this year and as part of your other courses. The other thing that's really important to look for as you go through the fur is to look for any sign of fleas. If you find little black specks in the coat, then you take a piece of white paper, you wet the paper, you put the black speck on the paper, and if it's flea dirt, it will dissolve and form a reddish stain, because flea feces are dissolved, have dissolved blood pigments in them. If you have an animal that has really heavy flea infestation, they have a lot of flea dirt on them, you give them a bath, the bath water will run off red because there is so much flea feces on them. Other parasites are things like lice. Lice tend to like to hang out around the head and neck, so that's a good place to look for lice. Ticks can be pretty much anywhere on the body. And the other types of parasites like demodectic mange and sarcoptic mange tend to be more buried in the skin, so we'd have to do a skin scrape for those. Cardiovascular system. Now this is something that we're going to be covering today, is the cardiovascular system, and it is an assessment of the cardiovascular system and the respiratory system are very key skills. They're extremely important for you to have a very good ability to assess those systems. Partly when you're trying to triage emergency cases, and also certainly when you're monitoring anesthesia. So these are very, very important skills for you to assess. So you'll all have your stethoscopes. Really important when you put your stethoscope on, that the earpieces, that they're at a slight angle and the angle is pointed forwards. Okay? So when you put them on, the earpieces are actually pointing forward slightly. Most stethoscopes will have two sides. They'll have this flat side, and then they'll have the bell side. And if you tap on one side, you'll be able to hear something. On the other side, you won't be able to hear something. You want the flat side most of the time. So you need to make sure that when you tap on the flat side, that you can hear that tap before you start, because you can actually turn this like so, and then I can't hear that, but I can hear this. Okay, so I'm going to turn it so that I can hear the tap. And then when we're listening to the heart, you basically want to find waggles. I'm sorry, my love. We're going to have to ask you to stand up again. Can you stand? Ups. She says, not in your nelly. Come on, ups. Good girl, ups. Good girl. Or even sitting. Come on, up, up. Good girl. So, when you are listening for the heart, you want to identify the point on the chest that is just inside medial to the left elbow. And sometimes in a nice slim dog like this, you'll actually be able to put your hand on the heart and even identify the heartbeat before you even put your stethoscope on. And that's a good way to know that you're putting your stethoscope in the right place. So put your stethoscope on, make sure that you've got the right side, and then you basically put your stethoscope just by that elbow. If you can't hear anything right away, then just adjust slightly back or slightly forward. And in a fit young dog like waggles, the heart rate is quite slow, so you have to be patient with yourself and give yourself time to hear. It's also good to run your stethoscope over to the other side and listen on the other side. And also you can push your stethoscope cranially further towards the head, up into the armpit. Oftentimes you can still hear the heart there. But the main part to listen is right on the chest, on the inside of the elbow. The other thing that's really good to do is to listen and palpate at the same time. So we're feeling for the femoral pulse. I'm putting my hand around the front of the thigh and I'm feeling for the pulse. And I'm trying to make sure that every time I hear a heartbeat, I can feel a pulse. If there is not a pulse for every heartbeat, that's called a pulse deficit. And I sometimes find it's helpful to close my eyes when I'm doing this, just so I can really focus on hearing and feeling, every single heartbeat. There are several things that we're listening for. We're obviously listening for the heart rate. We're also listening for the heart rhythm. There is a normal arrhythmia that we hear, especially in younger, fitter dogs like this, which is called a sinus arrhythmia, which is where the heart speeds up and slows down, usually in time with the breathing. Other types of arrhythmia would be abnormal. We're also listening for signs of a heart murmur, the descriptions of the murmurs they're normally graded out of 5 or 6. So if it's a grade 3 out of 6, then the murmur is about the same sound intensity as the heartbeat. That's kind of the ballpark. So if the murmur is less obvious than the actual sound of the heartbeat, then it's grade 2. Grade 1, heart murmurs are really hard to hear. They're really tiny. And a grade 6 murmur, you pretty much don't need a stethoscope to hear it. You could probably even just feel that there's something not quite right with the heart because the murmur is so loud. What else? Cardiovascular. The other thing is when you're feeling the pulse, you want to feel whether it's a nice strong pulse, is it really easy to feel that pulse, or is it a weak pulse. And that is a very hard assessment to do because a slim animal is much easier to feel the pulse than an obese animal. So sometimes the body composition can affect the pulse strength. Okay, so respiratory system, we start with looking at the nose and looking for any signs of discharge. So we're looking to see if there's any sign either current or previous. Now the other thing I like to do, especially if there's a history of intense sneezing or a history of nasal discharge or upper respiratory noise, is I actually put my finger over one nostril and I listen. And then I put my finger over the other nostril and then I listen. And basically what you're doing is you're seeing whether there's good airflow on both sides. The other part of assessing the respiratory system is palpating the throat, which we talked about before, palpating the trachea, the windpipe, just seeing if you can elicit a cough, and then obviously auscultating the lungs. Now the lung fields in the dog are pretty much found right under the ribs. So You can go, obviously not on the top because there's the spine here, so you go down a little bit, and you're going to be behind the elbow. You want to be a bit above the heart, and then waggles his ribs, go all the way back to here, so this would be a great place to listen. And you're listening for any signs of wheezes or crackles. We're going to listen on both sides. Usually you want to at least listen on both sides, ideally dorsally and ventrally. She sounds fine. And we're going to measure the respiratory rate. Ideally, we should measure the respiratory rate before we start doing anything. So if it's a cat in a carrier, you open the door, you look at the cat, you measure the respiratory rate before you've even touched them. Because they often get stressed when you touch them, and that can affect their respiratory rate. In a nice calm dog like Waggles here, you could certainly assess the respiratory rate in the middle of your examination. The easiest way to look and see when they're breathing is to actually look at the movement of the abdomen, and because the abdomen moves in and out with each breath. Sometimes if they're breathing quite deeply, then you can also do it by feel, so that you can look at your watch or your clock at the same time. You can see the chest is going up, and I can actually feel that movement. So I can do it by touch or by looking. Right. Abdominal palpation. The next is next. Now, abdominal palpation is what I would consider to be a higher level skill. What I really want you to master this semester is, first of all, just get used to feeling how soft and squishy an abdomen should be. Now, sometimes it can be hard and tense just because the animal is tense, but sometimes it can be hard and tense because the animal is painful. So you need to get used to that usual feeling of soft, squishy abdomen. And also, as you feel around, if the animal suddenly braces and tenses up, then that could be an area where they're painful. Are you going to stand up for me? She says, actually, I'm pretty comfy in here. Ups, ups, ups. Good girl. Good girl. So I like to stand behind an animal when I'm doing abdominal palpation. I put one hand on one side, just behind the ribs, the other hand on the other side, just behind the ribs. And I start off pushing my fingers firmly into the abdomen, starting just behind the ribs, and then gradually working my fingers backwards. Oh, so relaxed. What a good girl. Now, there are individual structures in there that you can feel. I'm not expecting you to be able to feel the liver or the kidneys, but one of the things that you will need to get used to is getting to know what it feels like to palpate the bladder. Now, to palpate the bladder, it's better to do it with one hand. So get your thumb on one side and your fingers on the other side, and you're going to come up from below on the belly. And then we're going to squeeze, and again, we start fairly far forward, and we're going to gently squeeze fingers out and then in, and then move slightly back and just gradually work the fingers back. Then as you get towards the back, you should start to feel something that feels a little bit like a balloon filled with water. Now, just depending on how big the bladder is, it may be easier or difficult to feel. But that is something that you need to practice, because when it comes to collecting urine by cystocentesis, you need to be able to feel the bladder to confirm that you're sticking the needle in it, because we do not advocate for blind cystocentesis. The other thing which you can do at the same time is if you actually push your palm of your hand fairly firmly up onto the belly and then reach above where the bladder should be, I can actually feel the bottom of the spine now, and then I move my fingers in below the spine and then I pull them down slightly. That's the area where the colon is. So the colon runs, the descending colon runs just below the spine, starting just under the rib cage and all the way back to the anus. If the colon is full of very hard firm feces, then that can be a sign of constipation. So the three things that you need to learn about abdominal palpation are, is it nice and soft and squishy all over? Am I getting tensing up in certain areas of the abdomen? Can I feel the bladder? So switching to one hand, can I feel the bladder? Moving my fingers back until I feel something that feels like a squishy balloon. and then also pushing the palm of my hand up onto the belly and then reaching up and over where the bladder should be and feeling where the colon, the descending colon is. So those are the components of the abdominal exam that you will need to learn. The musculoskeletal system, again, this is something that mostly the veterinary surgeon, the veterinarian will do, but you do need to get into the habit of, first of all, looking for signs of lameness when the animal's coming into the examination room. So assessing for pain. Also, you can assess for pain in individual areas. So for instance, if I was going to assess Waggle here for signs of neck pain, I would put my one hand on the back of her neck and lift her head all the way up. Oh, she's so good. And then I would put my hand on one side of her neck. I would rotate the head all the way around. Most dogs should be able to touch their nose to their flank without having a problem. And that on both sides. For dogs that are really tense and nervous, sometimes, but they're really food motivated, sometimes you can get them to follow a treat around. And then we go all the way down. Now do be aware that if an animal has neck pain and you suddenly hit the spot that's painful, they may scream and they may act actually quite dramatically. So it's worth being aware of that. If the history suggests, sudden screaming in pain, that's often a sign of neck pain. And as you're examining them, you have to be very careful and also warn the owner that there's a chance that they might react kind of vigorously. So that's neck, and we come back to, which is the cervical spine. We come to the thorax, which is the thoracic spine is the bit that is over the top of the rib cage. So we're going to take our famous thumb and fingers, and we're going to press down. We're going to just press all the way down. No, you don't get to sit yet, baby. You want them to be standing. So you press all the way down, and they should stand firm. I know she wanted to sit, but that's just because she wanted to sit. But I'm hardly putting any pressure here. I'm just encouraging her to stay standing. But if I get to here, and she really ducks away, see, I can actually push down quite hard here, and she's actually not really objecting to it. But a sign of pain would be if there's kind of muscle tensing or twitching, turning around, trying to bite you, or if as soon as you get to this area, they will not bear any weight at all with pressure. Another way to assess for pain, so this is the lumbar spine now, so thoracic, lumbar, lumbar spine, and then this where the front of the pelvis is, you can feel kind of a couple of bones here. This is what we call the lumbosacral region. If you lift the tail, and they are very painful when you lift the tail and yank it forward like this, that's also a sign of pain in the lumbosacral area. I also like to extend the hips back. So I'm supporting the weight with my hand under the belly, take my other hand, put it around the front of the knee, and I extend the hip back. The leg should go back almost to horizontal, and that's what we call the normal range of movement. So the normal range of movement, they should be able to flex it all the way up forward, so the knee's touching the belly, and they should be able to extend it all the way back so the leg's almost horizontal. And they should be able to do that on both sides. If you get to about here and you're starting to get a lot of resistance, or if they're trying to turn around and bite you, or they're showing other signs of pain, then that could be a sign of hip arthritis. Now some dogs are more reactive than others. Some dogs are very stoic. So it's really good as you're doing this, if you can actually look at them, if they're panting and they suddenly stop panting and start licking their lips, that's a sign of pain. So sometimes the signs are quite subtle and sometimes they're quite obvious. Or if they suddenly turn around and look at you and lick their lips, that can be a sign of pain. So it's good to watch the head while you're assessing for pain. On the knee, I'm right-handed. I put my left hand on the front of the knee. I flex and I extend. Again, we should be able to get the legs straight. So if we can't get the legs straight, then that wouldn't be considered a normal range of motion. I should be able to get the hock up to tuck the back here. The hock should be able to touch her buttocks area. The same with the hock. You want to be able to get that straight. It doesn't flex all the way up to touch the foot on the leg normally. That's about normal flexion. So you're going to assess for range of movement. In a full physical exam, we're going to assess for pain, and we're going to assess for range of movement, and we're also going to assess for symmetry. So for symmetry, they need to be standing symmetrically. with weight evenly on both sides, and you're going to use both hands. You're going to run your hands over the leg, around the front of the stifles. I normally feel on the front of the stifles, and then feel around the back of the joint, and then I run my hands down. I feel down the Achilles tendon here. Make sure that that's not swollen, and then all the way down to the feet. So you're assessing for lumps, bumps, swelling, pain, and you can do the same on the front leg. You are being such a good girl, Agnes. You are. Okay, so that's about it for musculoskeletal. The final component is the nervous system. And again, this is a more advanced physical examination skill, something you should definitely have mastered by the end of the semester, but we're not really going to talk about it very much in this particular lab. And I'm not going to go through what we would consider to be a full assessment of the nervous system. But there are some things that you can do just to make a basic assessment of the nervous system. They are, first of all, what is their mental state? So usually we categorize animals as being bright, alert, and reactive if they're kind of normal. But obviously if they're comatose, or if they're very slow to react to commands, if they're acting confused, if they're staggery, if they're going around in circles, if they have a head tilt, anything like that, then all of those things are abnormal. And those are the kind of things that you can assess right up front as they're walking into the room. It's also really good. What I also do is when I'm talking to the client and I'm getting a history, I will often also be watching the animal and watching what they're doing. And that, again, is twofold. One is to assess their behavior. Are they looking at me sideways? If any time I approach them, they're kind of shying away. And also just to see what their mental health is. Are they just kind of lying flat out on the ground? Or are they watching what's going on, seeming pretty alert? Those kinds of things. The other components of the nervous system that we would expect you to know how to do are, first of all, to examine the eyes. And unfortunately, I don't have a light right here, right now. But you get your pen light and you shine it into the eyes, and you're going to look at the pupillary light reflex. So the pupils, if you remember, are the black spots right in the middle of the eye, and they expand and constrict. The iris is a muscle that expands and constricts that hole in response to light. So you're looking to see that the pupils get smaller, that they constrict when you shine a light in. The other thing we can look at is what we call a menace. And the menace is basically, do we blink when we think something's going to hit us? So she's so relaxed right now, she probably won't do it. You see, I don't know if you can see there, but that whenever I get my hand close to her head there, she blinks. And you should assess that on both sides. Very good, aren't you? The other thing we look for in the eyes, which is an assessment of nervous system function, is to make sure that the eyes are still. If the eyes are flicking from side to side, that is called nystagmus. And it's important to record whether it's side to side, or horizontal nystagmus, or up and down, which would be vertical nystagmus. Usually both eyes are equally affected. And then the other components of the nervous system, I'm sorry, my love, we're nearly done. Can you stand up, baby? Is we also assess, we can also assess a few reflexes. One of the most basic reflexes is, do I know where my limbs are? So, do I know that when the vet's turn my foot upside down, that it's not in the right spot? Now, in a normal animal, it's actually not possible to get a normal animal to leave their foot on the ground with the foot the wrong way up. She really wants to turn it the right way up, as you can see. But in an animal that has some kind of spinal injury, where the signals are not getting through to the brain properly, this is called a test of proprioception. And it's a test of how aware you are of where your limbs are. So usually, if you close your eyes and you put your hand above your head, you still know that your hand's above your head. It doesn't matter that you've got your eyes closed. And so that's your sense of proprioception. And so you can put the paw the wrong way up. They should immediately place it the right way up. The other thing you could do is just pull the leg out to one side. Can you stand up, baby? Stand up, my love. Good girl. So you can do the pull the wrong way up. You can also pull the leg out to one side and see that they place the foot back right where it started. So if they either leave their paw out there, or if they place it really sluggishly, like halfway back, again, that can be a sign that proprioception is abnormal. We also do, sometimes you'll see the veterinarian do hopping or wheelbarrow walking just to see how strong they are and what their reflexes are. And then there are some local reflexes. There's the knee tap reflex and a couple of other local reflexes such as if you pinch their toes like this, you'll notice that she pulls her paw away. Now that tests not only the sensation that, hey, you're doing something that I don't like, but see, she's also reacting, so she can feel. But there's also a reflex that just says that if you pull on my foot, I'm going to pull my leg away. So there's actually, when you're doing this, you're actually testing two reflexes. One is the motor reflex, which is just pulling the leg away, and the other is the sensory reflex, which is, ow, that hurts, or potentially, ow, that hurts. I wasn't doing it enough to hurt her, but she still doesn't like it because most dogs are ticklish on their feet, so they don't like it when you do that. So I know that she has both consciously received a message in her brain that says, I don't like that, as well as there being a local reflex here that allows her to pull the leg away. If you have a really severe problem with the spine, a broken back or a intervertebral disc disease where the disc is really pushing and pressing very badly on the spinal cord, so that signals are not getting up to the brain anymore, you will still have that, you may lose that conscious perception of pain, but you'll still get the leg pulling away. So you'll still get a localized motor reflex that travels just up and down here and pulls the leg away, but you may lose what we call a deep pain reflex, which is the ability to actually consciously feel that pain. So I think that's about all we need to talk about for the nervous system. There's a couple of other things that I haven't talked about. One is just assessing the back end. So if it's a male dog, usually, and it's unneutered, he's unneutered, then usually we'll palpate the testicles. If you have a puppy or a kitten in for an examination, it is super important to make sure that you check the sex, especially in a cat, because mistakes do get made on a fairly regular basis. And it's not unheard of for veterinarians to turn up animal all scrubbed up on the table for a spay, and then, oh, oops, somebody missed the fact that it was actually a male cat, which is kind of embarrassing. You also want to make sure that the vulva in a female dog is comfortable, there's no discharge, especially if she's intact. Spayed females will sometimes get a little bit of irritation around their vulva. In a male dog, once you've checked that they've got two testicles, make sure that they're both symmetrical and that there's no lumps and bumps there. And then by the anus, we also want to make sure that there's no swellings. You can actually put your fingers to either side of the anus and actually feel the anal glands without emptying them, just to see if they're enlarged. If there's an anal gland abscess, then sometimes there'll be a little bit of a hole or a discharge there. Yes, baby, what am I doing? This isn't something really that technicians do, but sometimes we'll do a rectal exam for various reasons. The most common being in an intact male dog, we might want to feel the prostate gland, and that is done by a rectal examination. So those are the sex organs and the perineal area. Obviously, at any point during the semester, if you have any questions or concerns about the physical exam, then please don't hesitate to talk to us. It is super important that you have a very strong ability to do heart rate, respiratory rate, to assess the cardiovascular system, that you must know how to assess the cardiovascular system and the respiratory systems, and that you know the normal TPR for all the species that you're dealing with in any particular course. So those are your top priorities. Assessment of the mucous membranes, assessment of the heart and the lungs, and assessment of the vital signs, which are temperature, pulse, and respiration. Thank you very much.